Dr. Moss, I've been looking forward to this for a very long time. I really admire your work, and I've been following you for several years now. Not very long. I was only started looking into alternative or integrative treatments about 10 years ago. Um, so in the context of things, it's not that long. But everyone, I'm so excited for you to meet Dr. Ralph Moss. Dr. Moss is a medical writer. He's written or edited 12 books and 4 documentaries on questions related to cancer research and treatment. He's a graduate of New York University with his bachelor's cum laude and Phi Beta Kappa in 1965, and Stanford University with his master's in 1973 and his PhD in 1974. And he's a former science writer and, famously assistant director of public affairs at Memorial Sloan Kettering Cancer Center in New York. That was where that big scandal went on with Laetrile, which he so courageously uncovered, and the world owes it to Dr. Moss for that. Since leaving Sloan Kettering in 1977, Dr. Moss has independently evaluated the claims of both conventional and non-conventional cancer treatments all over the world. He currently writes Moss reports, which are detailed reports on the most common cancer diagnoses, and provides informational and personalized consultations for cancer patients and their families. And recently in 2019, he wrote The Ultimate Guide to Cancer, DIY Research, to help lay people research their own cancers. This is a 50-page report, which is available free of charge at the mossreports.com websites. And so Dr. Moss he's a treasure of information and wisdom, and just you have such a rich history in the cancer, industry. And also you're working with cancer patients one-on-one, so you have a lot of experience as like a clinician in seeing what works for people and what doesn't. So I'm really excited to get to pick your brain a little bit about treatments. And so most of the people watching here, they are already interested in integrative and alternative treatments. And your your DIY research ebook, that's the example that you give there is stage 3 colon cancer and how to research conventional treatments. And I believe that's an important part of any cancer investigation. When someone gets a diagnosis, you have to, I believe that they should look into all options, whether it's conventional and integrative and alternative. And so that's not something that I focus a lot on. But I think what a lot of people might want to know is what value do you think the conventional treatments have, and what percentage do you think it plays a role in helping people actually recover from cancer?
Well, I think you have to blend the two, as hard as that is. I don't think we're at a point yet where we could say that either conventional or complementary and alternative medicine has the answer, and you could abandon one and just rely on the other one. And people err in both directions, and there's a lot of emotion attached to this. A lot of times I think that the conventional doctors, the oncologists, are their own worst enemies, because like I did a consultation recently for a person who was really driven away from the conventional by the manner in which she was handled by the oncologist. And they didn't mean ill to her, but basically she was an intelligent, inquiring person, and they were telling her, in my opinion, correctly, that she needed to have chemotherapy and probably radiation therapy, but hormonal therapy. It was a breast cancer case, and but they didn't answer her questions. And it was in a different country, but the same thing goes on in the United States as well. And because they wouldn't answer her questions, it made her suspicious. It made her doubt. She felt insulted. Her intelligence was insulted. They just sort of laid down the law and said, "This is what you got to do." So I think when I hear about these cases, as we all do on the internet and so forth, of people who have had really good responses to treatment, and oftentimes complementary medicine is involved in that. My read on this, my general impression is that the people who really get cured of advanced cancers, they almost always have done some combination of things. So I don't think we have to make a choice. We shouldn't have to make a choice between the two. I think, you look at the options, you look at the treatments, and you see, is this something that I could go through, come out the other side, be whole, be in a good shape after I did it. I had cancer myself, and it was a prostate cancer. Excuse me. And it was two large tumors that were Gleason 8s. And if you look that up, you'll see that is considered a very aggressive cancer, which it certainly was, very dangerous kind of cancer. I was lucky because, initially I was horribly mistreated and went through the same agonizing, abuse, I would say, uh, at an Ivy League affiliated medical center. And it was just devastating. But I was very lucky because instead of going ahead with what they wanted me to do, and after completely misdiagnosing my situation, telling me basically that it was incurable and that nothing could be done but palliative radiation or hormonal therapy, um, I, I went to the one department, one urology department of which that I'm aware of, that has a naturopathic doctor, an ND, on staff, and that was one of my old alma mater, NYU, New York University, Langone, and I was able to get a urologist who gave me cryoablation, which is an outpatient procedure, no radiation. I never had I didn't have one ray of radiation in that entire time, and no surgery. It was just done by inserting a very, very thin needle, almost like an acupuncture needle. And that is able to freeze the tumor and destroy it in a way that actually stimulates the immune system. So that's what I wanted. And I couldn't have been luckier to get the particular doctor that I got at NYU with the guidance of the naturopathic oncologist there. So this is, to me, I would have said before I ever had cancer, I was saying the same thing, that the best thing would be to integrate the two professions, the holistic, or, you call it naturopathic profession, with the standard academic allopathic, and make one treatment out of that, not one where you have to go sneaking behind the back of your conventional doctor and go see somebody practicing in a kind of unconventional way. So that was my experience, and it couldn't have been more different than the first center that I went to. And luckily for me, I just a few weeks ago, passed my 5-year anniversary MRI, and everything's good. So I'm fine, and side effects have been minimal with that. So I think, I'm not holding myself up as like the way some people do, and they want to be your guru and tell you that they cured cancer, the way that some people have made professions out of supposedly finding some unique thing. I didn't find a unique thing. I found what I was looking for, which is what I've always been preaching, which is, why not get the best of both worlds? Since we know there's good in both things, and it's not necessary to politicize this, in a sense, to make this yet another thing in our society that, you have to choose sides and then fight like hell for, against the other side, which is what the temptation has been to do that. But I don't see it that way.
Mm. Yeah, thank you for that perspective. I did find there's a woman who I reached out to. I found her healing story on the Radical Remission Project website, and I asked her, what more about her story, and she said that she had stage 4 cervical cancer, and her friends wanted her to do only alternative medicine, and she couldn't find one survivor on the internet who had only done alternative or natural medicine. And she said, maybe this is something that you can help me with. I mean, in her story, she prayed, she couldn't find anything alternative, so she did high doses of chemotherapy. She didn't, she's more of an anomaly. She didn't change anything about her diet or anything, nothing about her lifestyle, but she had been given between 3 days to a week left to live, and she's still here like 12 years later. The last time I spoke to her, at least I can confirm it was 10 years later. And I researched that, and I actually couldn't find any myself who had only done natural therapies. And I went through dozens and dozens of survivor stories, and I found that they at least had an integrative approach, if not,
Well, I would, I've been in this field 45, 46 years. I have seen people who are cured of using just alternative medicine. For instance, there was a kid in Israel who had a recurrent glioblastoma multiforme, maybe the worst possible diagnosis in cancer. I don't know. Maybe there are some that are even worse than that, but that's notorious all over the world. It's a kind of brain cancer that, in the best of times, is extremely difficult to treat, and it's incurable because it extends itself sort of silently through the brain, and it's just a mess. Really, very, very difficult. And he had then no longer responded to, you can't operate on it, but he was no longer responding to radiation therapy. And the family, they were Russian emigres to Israel. They were not in the loop, as it were. There was no internet at that time, and they were not in the loop of alternative type thinking people. But they had a neighbor who had a supply of a viral therapy. It was a particular form of Newcastle disease virus vaccine, and that's all they had, and that's what they gave him. And they noticed that now he started to get a little bit, his speech started to clear up a little bit. He was not quite as he wasn't having as many seizures and so forth. He was a teenage boy, and they went back to the source of this medicine. They raised some money. They took him to, at that time it was in Budapest, Hungary, and they were able to get him some more treatment there, and he kept getting better and better. And finally, within a few months, he was completely cured. And this was not, people would say, oh, it's an anecdote. It's not an anecdote. An anecdote is something that somebody relates, they write it up without documentation. This is a case, a well-established case history, which is the oldest form of medical reporting, by the way, in the world. I mean, Hippocrates, the ancient Greek, used these kind of case histories. This is a case history. The medical records are all there. They're all were available. I co-authored a couple of papers on this, and one of the papers was I co-authored with the treating physician at Hadassah Hospital in Israel, as well as other people who co-authored this paper. And he's still alive. I met him. I met him 20 years ago. This is obviously took a few years ago. This took place, but I did meet him, and I have a colleague in Hungary. I just spoke to a couple of days ago on, in my I have a podcast called The Moss Report, and so I interviewed him for the podcast, and he's been in touch with him and with the family since then. He went on, graduated from high school, I think he went to college. He got married. He has children. Everything is perfect. He has a little bit of a limp from, we presume, from the radiation treatment or for the damage that maybe that the cancer had done. But other than that, fully functional, fully, completely cured 20 odd years later, never did any, no interest in alternative medicine, never did anything except that one thing. So yeah, I mean, that was one of my miracle, not mine, but the miracle cases that definitely changes your life if you pay attention to that. And I've been a big advocate for the testing of Newcastle virus vaccine ever since then. And we could talk about that, but I think it's starting to make a bit of a comeback. I'd also say that what's very important to me is the whole experience with William B. Coley and the Coley's toxins. This is something I stumbled into because when I went to work at Memorial Sloan Kettering in 1974, the most exciting, most important thing happening there was immune therapy. The president of this overall center, Lewis Thomas, the president of the institute, Robert Good, and the vice president of the one of the two vice presidents of the institute, Lloyd Old, were all immunologists, immunotherapists. So this was my schooling, was in immunotherapy, and through Lloyd Old, I met Helen Coley Nautz, whose father was William B. Coley, who used what we now know to have been an immune therapy for cancer. Starting in 1893, he invented a product that was a mixture of two killed bacteria. And by giving injections of that killed bacteria, he was able to trigger chills and fevers, fairly high fevers, and perfected a way of giving that treatment to cause remissions in cancer. And and his daughter Helen, after he died in 1936, then she could pick this up, and in the 40s and onward, thoroughly documented every case that they know about who was treated. She wrote 18 monographs, 18 single subject books on the topic of immunotherapy and specifically Coley's toxins, as they're called. And the cure rate, which by cure, I mean long-term remission or survival following severe illness, severe cancer. I would consider that a cure. If you live 20 years afterwards, we assume that there aren't very many active cancer cells left. But in any case, the long-term disease-free remission rate was very, very high. It was something like 50%. And the cases are extraordinary. And I guess part of it is that I had the advantage of knowing her and of meeting her and corresponding, and went to her house and saw the records and I talked to patients who had been treated. Sometimes this was just serendipity because I would be on a radio show like the Robert Atkins show or something, and somebody would call in and say, when I was a kid, I was treated by this doctor who cured me of cancer by giving me these injections. And I would say, well, let me guess, was his name William B. Coley? And then, yeah, how did you know that? I know that because nobody else could have cured you in that situation. So this was imprinted on me. And Helen gave me a set of those books. I have them. I look when I'm home. I look at them almost every day. They're right on my bookshelf. Hard to avoid them. But I think I'd start with that as a kind of bedrock, that I know that there was a treatment 100 or so years ago that was capable of curing cancer, even in very advanced situations. And that I will never give up on believing, because in order not to believe it, I'd have to believe that Helen Coley Nautz, William B. Coley, Brad Coley, his son, who was also, William B. Coley was one of the directors of Memorial Sloan Kettering, who was one of the four leading bone surgeons in the United States, a highly, highly honored and highly regarded figure. Helen kept up her researches until the year 2000. Lloyd Old was probably the greatest cancer immunotherapist of the 20th century, um, with an incredible array of achievements behind him. So many things that you've heard of that you had no idea that one person actually did this. But he was so modest that he he would put forward other people and keep himself in the background. The classic example being that one of his greatest discoveries was tumor necrosis factor, which was discovered in his laboratory. The first author on that paper, that famous world-shaking discovery of TNF alpha, was a lab technician who worked in the lab. And he credited her with the discovery. Can you imagine? It's unheard of.
Wow.
And made her the first author on the paper.
It's
These are the
incredible.
kind of people that I was dealing with. Brilliant, uh, insightful, honest. You don't come across people like this every day. That's just the way the nature of the world is, that you just, you know, you don't find that. And I was, as I say, I lucked into this, uh, but I can't give up on that fundamental knowledge that I have, that this happened. This isn't like Rife Machine, or I'm not denigrating Rife Machine, but there's a lot of things out there that have interesting stories behind them, but they don't have documentation. People will tell you, oh, they came, the men in black came in the middle of the night and took the records away, or they took the device. Well, fine, maybe they did, maybe they didn't, but you don't have the proof that that mysterious alternative treatment worked. But we have the proof that Coley's toxins worked. Lloyd, Helen's organization was called the Cancer Research Institute. Lloyd was the first scientific director. After he passed away 10 years ago, the second scientific director is James P. Allison. Lloyd basically asked for Jim Allison to be appointed in his stead. Jim Allison won the Nobel Prize in 2018 for the discovery of immune checkpoint inhibitors. So I connect the dots. I see what this is. Basically, this is a recognition of what I'm talking about. It's the fruit of the current revolution in immunotherapy, whether anybody wants to acknowledge this or not, came in the direct descent from William B. Coley, who himself stumbled on the fact that people who had a particular kind of infection would sometimes have spontaneous radical remissions, to use that phrase, of their cancer. That was an observation that had been made repeatedly. I mean, we know this in the 19th century, repeatedly, people said, you know what, if you get erysipelas, you might be cured of cancer. And even Chekhov, not the Star Trek Chekhov, but the writer Anton Chekhov wrote about this in his letters. He knew about it. And the Germans had actually experimented with giving people erysipelas in the 19th century. But Coley refined that discovery. And so that's, to me, the bedrock. So I don't have to, in my mind, and I know that this can work, but we have to, that said, I mean, it has to be refined, it has to be improved. Unfortunately, in the capitalist society that we live in, you also have to make money with a treatment if you expect it to be accepted, which is another issue, another problem. So it's not easy, but it's real. And why did that boy Alex in Israel have that remission of cancer? It's because of the immune system. It's almost certainly because viruses, when they get into the system, some viruses will preferentially kill cancer cells. It's partially that the virus is toxic, but more to the point, we're almost positive that the Newcastle virus expresses itself on the surface of the cancer cell, which makes it a tempting target for the immune system. So if you have a fully functioning immune system, your immune system will recognize that now marked cell and destroy it. And that's how you activate the immune system. And I mean, the immune checkpoint inhibitor drugs are very important, like Keytruda, Yervoy, Opdivo. I mean, they're important not just in keeping, um, you know, um, certain magazines alive because they take out 3 and 4 page ads for these things, but they really, there are situations where they really work very well. But even Jim Allison has um, written 2 papers saying that the ideal of an ideal treatment would be to combine the immune checkpoint inhibitors with Newcastle disease virus. Amazing, because Newcastle looked like it was completely a non-starter in terms of treatment. And then more than two of the leaders, people from MD Anderson Cancer Center and from Memorial Sloan Kettering, have came out with these papers saying, we need to combine these two. So I think that we're getting closer, definitely getting closer, but the, the whole picture will come together at a certain point. But you can't make that picture. You can't put the jigsaw puzzle together and exclude half the pieces because they're in your mind illegitimate alternative medicine. And conversely, you can't put that puzzle together and expect and leave out the conventional part of it. That's not going to work either. If you tie one hand behind your back, you're probably not going to be able to do this.
Yeah. After it's interesting how my research has kind of opened up my eyes to different things about my own healing journey. I went through all the standard treatments, the first and second diagnoses, and then 2 weeks after I finished my radiation treatments, I found out that I had more cancer, and it turned out it was in my neck, lung, and my spine. And my doctor said I had she was actually at NYU also, Langone, 7 months without treatment, 14 months with treatment. And my mom had a friend who was speaking into our lives and said, Bailey's going to beat this. We just have to find what's going to work for her. And that's how we happened upon Coley's toxins and the Gerson therapy. And we took a while to research, and it was maybe 2 weeks before I did any kind of intervention besides, actually, my oncologist recommended that I start PABA, which is a B vitamin, which actually has antiviral properties. And then I started another supplement, which is a redox signaling supplement. And I was spraying it on my body where I had the cancer, because there were some, people who said that they had cancer remission from that supplement. And then I did do 1 round of chemo pills, Temodar, which my oncologist wanted me to do concurrently with the PABA, because she found PABA killed melanoma cells in her lab. And then at the end of that 1 week or 5 days, I had measurable shrinkage I had a cancerous node under my chin. And I thought, that could be just human error. It was 2 different people measuring. And then I had it measured again, and it had shrunk another half a centimeter. And I, the doctor thought that it would take at least a month for the chemo to work. So I was kind of like, unsure of what was happening there. And then I had decided that I would go to Mexico for Coley's and the Gerson, because they both had, very remarkable results. And then, so I did that, and then I had remission 10 weeks later. And by the grace of God, um, but, looking back, I wonder what would have happened if I didn't go and get Coley's toxins or do the Gerson therapy. And it could have gone completely away, or maybe it would have gone away to a certain extent, and then I would have needed something a little bit extra. So I was wondering if you recommend doing both at once, like conventional and alternative, or maybe doing, doing the least harm first?
Well, there's so many kinds of cancer and so many stages, it's hard to generalize. My feeling about alternative medicine is that it's perfectly um, acceptable, rational in early stages and in late stages. I think the trouble area is in the middle, possibly slash probably curable through the conventional means, in which case, maybe just hedging bets, I think it's better to combine the two, combine the conventional with the alternative. If you've got, like, for instance, if you're in a active surveillance state, or what they call watchful, what used to be called watchful waiting, um, most of these things, these alternative things, are innocuous. They're harmless. You can do them. You're not going to be neglecting doing something that's known to be curative because you're not in that situation. Um, so it makes sense if you have the money and you have the inclination and the time to do that. Conversely, if you're in a situation where the best that they can offer you is participation in a phase 1 clinical trial, somebody I consulted for recently in that situation, I don't really, or phase 3 clinical trial. I mean, they have so many problems involved in clinical trials, not the least of which is they make you stop taking any other treatment that you might want to take. Um, I'm not such a big fan of most clinical trials, and certainly if you've been basically told to go home and set your affairs in order, which is not quite as common today, but still we have so many people dying of cancer at a certain point, the doctors don't really have much to offer. Then again, you are in a situation where you have very little to lose by doing the complementary treatment, as long as you are up to it and up to making the trip to Mexico or Germany or wherever. Um, but it's in that middle area that I think it becomes problematical. I think the most problematical thing that I see, it's almost always women with breast cancer who reject all conventional therapy in at the stage where it's probably curable through the conventional means. And it used to be that chemotherapy in particular was overprescribed for women with breast cancer. Nowadays, that's rare. That's relatively rare for reasons we could discuss. But I find that a lot of times people will they just so averse. They've just been so beaten up by the medical system, or they don't want to get involved in it, and for whatever the reason is. As I say, I would just make a observation that it's very often women with breast cancer that I would consider to be probably curable through conventional means. That's a very tough situation. And I'm not a big supporter of doing alternative things. I certainly need to know what that alternative was, because a lot of what people opt for in terms of alternative medicine is very poorly documented, and there isn't really all that much um, information or proof, of the effectiveness. So I'm not going to make a categorical statement about that. Um, but it's and again, it's complicated, right? Because you have a lot of different kinds of cancer. If the I and sort of segueing a little bit, um, I am not of the school that believes that complementary treatments are by their nature conflict with conventional therapy. A lot of oncologists seem to think that. American oncologists seem to think that. I don't believe that to be. I don't think that's a proven fact. And if we're talking, you can't have evidence-based medicine when it comes to the conventional, and then throw the principles of evidence medicine out the window
and be guided by your gut or by some small sampling of studies that are not representative of the totality. And there is no proof that even antioxidants conflict with even so-called pro-oxidant alkylating agents. There is no proof of that. It sounds good, sounds right. Pro-oxidant versus antioxidant. What do you think the antioxidant is going to do? It's going to destroy the pro-oxidant. Well, what's a bigger antioxidant than vitamin C? But if you give vitamin C alongside chemotherapy, like gemcitabine, guess what? The patients live twice as long than if you didn't give the vitamin C. So what's going on? Well, vitamin C can function as a pro-oxidant, and vice versa. So you get this, complex chemical interplay. But if you look at the data about this, and Keith Block, who's an oncologist in Skokie, Illinois, he's done some wonderful papers, surveys on this, and looked at the world literature and published his own results. There is no proof that antioxidants will conflict. And for radiation therapy, I did a paper for integrative cancer therapies, with one exception, which was the so-called Bairati study in Quebec a few years ago. There is no evidence that antioxidants will conflict with radiation therapy, but that Bairati study was cited like hundreds of times, played up in the media and so forth. A few years later, Isabel Bairati herself published another paper showing that the only people who were harmed by taking vitamin E or vitamin A, synthetic single nutrient, synthetic vitamins, the only ones who were harmed were current smokers who were receiving radiation therapy and still smoking when they were receiving the radiation therapy. And then if they took a synthetic vitamin A or a vitamin E, there were more tumors and larger tumors in that population group. Nobody else in the entire study was harmed. I think that I figured out that there were two commentators on the internet, two people who ever noticed that second study. I think I was one of them, and Keith Block was the other one. But that got next to no coverage. The paper that seemed to show that there was a conflict between the antioxidants and the radiation was widely covered all over the world. So you can't undo the damage that's done in the age of the internet, especially. You can't undo it. It's the same thing with vitamin C. There was a fellow at Memorial Sloan Kettering who noticed that there was vitamin C inside cancer cells. All right, it's an interesting observation. He panicked and said that taking vitamin C, intravenous vitamin C, would make cancers explode. That was the word that they used. They put out a press release from MSKCC, spread this all over the world. This is still being repeated. But meanwhile, at the University of Iowa, which is fantastic organization, they did an actual clinical trial with vitamin C and showed that the addition of intravenous vitamin C to gemcitabine plus radiation had the effect of doubling the survival time in pancreatic cancer. So one guy had a theory that was completely misguided based upon a misunderstanding of the very facts that he discovered. Namely, was the vitamin C in the cancer cells to promote the growth of the cancer, or was it there fighting the growth of the cancer? He didn't know. He just panicked, basically, and fed into the hands of the quackbuster mentality, and then that got publicized all over the world. The study showing that in actual practice, in actuality, the intravenous vitamin C benefited the cancer patients and doubled their survival time, that got very little publicity, but you can't undo the harm that's done by the original one. So it takes generations basically to, move this ship around, because things get so embedded in the public, in the minds of the oncologist, basically. And this is just, the way that the oncology profession. I mean, why would this, go back and say, why would this be? We know that the oncologists are very well-intended people. They're very intelligent people. They definitely have the interest of their patients at heart. I know that, and I'm not. In no way am I anti-oncologist or down on oncologists. But when you look at the structure, if you pull back the camera a little bit and look at the overall structure of the profession, the glaring fact is that the leadership of the oncology profession is taking millions and millions and millions of dollars from the pharmaceutical companies. And it isn't just the legitimate taking money to perform studies. I mean, you could critique that as well, but say, all right, well, where else are they going to get the money to do the studies? I'm not talking about that. I'm talking about taking gifts from the companies, money for the personal use in their own pocket, from companies for doing no more than maybe occasionally giving a lecture to other doctors on how wonderful the drugs of that company are, or whatever the lecture topic might be, doesn't matter. Honoraria or speakers' fees or whatever, however they consulting fees, however you want to disguise it, it's basically payoffs, and it could reach as much as $3 million per person, as we know, because it was on the front page of the New York Times a couple of years ago about the physician in chief at Memorial Sloan Kettering who had taken $3 million to promote, and coincidentally was promoting the drugs, grossly promoting the drugs of the companies that he was taking the money from. This is a pattern. It's not an isolated incident. This is a pattern that the key opinion leaders within the field are basically on the take, and so it's a problem that I discuss in my book, Cancer Incorporated.
Yeah.
Which is available free, by the way, at our website, morsereports.com.
Thank you for such a valuable resource. Yeah. All right. Well, I'd like to open it up for Q&A, and just for a couple minutes. Are you good for another 10 minutes or so?
Yes.
Okay. But before I do that, I'd like to ask you, because we have many people who pray, how can those who would like to pray for you?
Well, you don't have to pray for me. I'll say, I appreciate the sentiment, but if you want to help us, you just have to go, you'll help yourself too. You just have to go to our website, which is morsereports.com, and sign up for our various products. We have a podcast that we do, and also we offer our latest book, Cancer Incorporated, and our latest film, Immunotherapy, The Battle Within, free of charge for people who sign up at the website. So I think it'd be mutually advantageous for everybody to do that.
Yeah, and spread the information far and wide. Thank you for that. All right, so we have about 10 minutes, so let's see how many questions we can get in. If you have a question, please unmute yourself and ask away.
Hi, my name is Amy, and I was diagnosed with stage 4 metastatic breast cancer in October of 2017. And I was wondering what your opinion would be on using THC and CBD tinctures.
I don't see any harm in it. I think we're just at the beginning of understanding that the role of cannabis in cancer. I remember when I toured Israel, I was struck. The head of one of the departments at Hadassah Hospital said that we give cannabis products to all of our patients, and cannabis wasn't even legal in Israel, but it was legal in terms of medicinal marijuana. So I'm hopeful about it, but it falls pretty far down on my list. Not because it could turn out to be very good, but really what we have is basically anecdotes from Rick Simpson and so forth, and I don't feel that that's a very firm foundation yet in terms of treatment. Things that are more likely to be effective are things for which we have a great deal of research, and we know things that will kill cancer stem cells, for instance, metformin as a drug, certain food extracts, food chemicals like sulforaphane and curcumin and green tea, EGCG. There's a ton of research on those things. So I'm hopeful about the whole question of cannabis because it was repressed. It still continues to be repressed at the federal level. So there's a good reason why this very, very interesting, intriguing plant would never have gotten it to do in terms of research. But next few years, I think.
Thank you.
Thank you, Amy.
I'm Sudhakar. Hi. I'm a stage 4 sarcoma survivor. I've been surviving for the past 14 years. And I'm with chemotherapy, and now I'm with immunotherapy on and off. And I had a complete response, but again, the cancer came back in 2018. Mm-hmm. So my question to you is, what do you think about vitamin C IV with immunotherapy? With interactions will happen, or can I take an IV vitamin C with my current immunotherapy? I'm taking Opidui and Ervoy, that is BMS drugs, and I've been with the trial for almost more than a year. So let me know your thoughts.
Well, it's one of the treatments, one of the adjunctive treatments that Dr. Kleef has used in Vienna for the past 5 years is IVC, intravenous vitamin C, and some other things as well. I think anything you can do, as long as the doctors know that you're doing it, because these drugs that you're taking have a lot of side effects, potential side effects themselves. So, and if you make the immune system too active, there's always the possibility that you'll go into a crisis like a tumor lysis syndrome or something that could make it, push you over into grades 3 and 4 side effects. So I think you have to do this either with a holistic doctor, or at least make your dermatologist or oncologist aware of the fact that you're doing it.
Thank you. Thank you. Okay. Christina, do you want to answer your question?
Hi. I had a random question about the GBM brain cancer you had mentioned. My father actually just passed away in October.
Yeah.
And I was wondering what studies or information you have regarding whether that cancer is hereditary, and if there's like tests that I or like my siblings could possibly do. And just to also add to that question, everything happened like so fast when he was diagnosed. And I'm sure when anyone is diagnosed, like there's so many things like rushing through your head. How do you find the best doctor for treatment when you're just like diagnosed with this information and you don't even know where to turn?
I don't think it's hereditary. I would have to research that. I can't think of any study that I've ever seen that said that it's hereditary. So in terms of finding the doctors, the brain tumor organizations maintain lists of them. I use the U.S. News and World Report ranking of hospitals very much. I find that to be very helpful. I'll also look at people's publication records. Like I have access to the big cancer textbook, but there are other books that you could look at. and or you look in PubMed and you see who are the big publishers, you know, the people who have done the most research. And that's another way that I research doctors in particular, or I'll look at a particular topic that I'm interested in, and I'll see who has published on that particular topic. So, you know, but there is no really objective way, except to use, as I say, things like US News is very dependable for more for the hospitals, I would say, than the individual doctors. Okay.
Thank you, Christina. And there's one more question. We'll leave this as the last one. Yesenia asked if you've ever had a patient, Dr. Moss, with triple negative secretory breast cancer with metastases to the lungs with the NTRK mutation. And I actually just looked at something that you had published on triple negative breast cancer.
So I'm not a medical doctor and I don't have patients, just to be very clear. But I did co-author a paper with Dr. Cleef on a client of ours who had triple negative breast cancer. I'm not recalling the particular genetic mutation profile with that. And by the way, I've written a lot about that in my book, Cancer Incorporated. So if you want to get a bigger picture in terms of genetic versus metabolic origins of cancer and so forth, look at that. Yeah, Dr. Cleef had a patient where there was so much lung metastasis you could barely see normal tissue on the X-rays, and he got a complete remission of all of that cancer, and it lasted 27 months, and the patient passed away after 27 months. Didn't go back. I don't think she could afford it. But this was when he was in Vienna, Austria. He's moving his clinic now, but has published the results of his treatments, and it's very good. It's a combination, was and is a combination of low doses of immune checkpoint inhibitors with other immune stimulating treatments. So I think it's a situation that is definitely can be benefited by immunotherapy.
Yeah. All right. Thank you so much, Dr. Moss. It's been such a pleasure and an honor to have you.
You too. Lovely talking to you. And we'll
Thank you.
talk again sometime soon, I'm sure.
Sounds wonderful. Thank you so much. Thank you, everyone, for joining. Have a great night.
Bye.
God bless.
Bye.
Bye.